Lazzaro Medical, again, we're creating a solution for the most common disease that hopefully very soon you will have heard of, called tracheobronchomalacia. And every common surgical procedure has had a beginning, and this is the beginning of giving people their ability to breathe back. Good afternoon, everybody. I'm Dawn Bitz. I'm the president of Lazzaro Medical. Before we get started, I want to pause. So we're all collectively doing something in unison. We all have something very much in common at this very moment. We are all breathing. The best part is we don't have to think about it. It happens naturally. But what if I told you that 40 million people cannot do what you just did? They must think about every single breath they take, and breathing is always on their mind. So respiratory-related conditions like COPD and asthma are well-known diseases, yet about 20% of those respiratory diseases, they actually have the most common disease that you've likely never heard of. And that disease is actually something called tracheobronchomalacia. Now, it's a very long word, but essentially what it is it's a structural collapse, an anatomical collapse of the trachea, which deviates from how you normally breathe. And it actually affects an estimated 8 million people in the United States. There are congenital forms of tracheobronchomalacia that affect pediatrics. But as we've gotten older as a population, as we have other comorbid types of problems, we're seeing an increase in tracheobronchomalacia. However, it's often misdiagnosed because it actually mimics other diseases like COPD and asthma, and it presents with a chronic cough. So you might actually know somebody in your family, your friend group, or even your relatives that are struggling and coughing constantly. And oftentimes the root cause of that is this disease, TBM. However, historically, the intervention or the surgical correction of this disease was actually very, very risky. And it was so risky that it was often riskier than the disease itself. Until now, Dr. Lazzaro, one of our co-founding members of our organization, is a very, very well-known thought leader in the thoracic robotic space. And he actually created and crafted and pioneered a life-changing robotically assisted, minimally invasive tracheal repair. And we formed Lazzaro Medical to actually be able to create a patented scaffold system that we can use for these patients who are suffering from TBM to actually give them back their ability to breathe. Our pathway for our scaffold system, we're actually in process of putting together our submission to the FDA. The current pathway is a 510K process. So for those of you who are familiar with this process, it's actually one of the most streamlined approaches to be able to take a product through the FDA. This product actually helps standardize and democratize. So it takes out the complexity of fabricating any kind of mesh product in the operating room and creates a commercially viable product that really any robotically trained thoracic surgeon can actually utilize. And the very interesting thing about this procedure is it's very highly profitable. It actually has existing reimbursement codes, both DRG and CPT codes, that reimburse for this overall procedure. And it's actually one of the most profitable procedures for a given institution. Our scaffold system actually helps reduce operating time by 50%. So it makes a very profitable surgery even more profitable for a given institution. There currently is no competition. And our patents, our partnership with the largest thought leaders in the nation, as well as the largest institutions, as well as our relationships with other very important strategics, create very significant barrier to entry as we're opening up this market. But let me tell you, the biggest and most impactful thing is that we're giving these patients back. That was actually one of our patients that Dr. Lazzaro has actually treated. 2 weeks prior to her surgery, she was actually on a home care ventilator. 2 weeks later, she's on the beach, being able to use her lungs for the first time in many, many years. This is a $40 billion untapped market. TBM basically affects about 8 million patients, about 50% of COPD patients, with about 50% of those, or 4 million patients, actually experiencing a severe form of TBM. This actually equates to about a $40 billion market opportunity that we're on the forefront of. And not only our product with our scaffold system, but we actually have several future innovations that are going to help streamline our ability to socialize and train physicians on the procedure, as well as our ability to diagnose patients with TBM, along with other respiratory problems in office, in the pulmonary and ENT's office, as well as then the ability to increase the safety of the overall procedure using a very specialized double lumen endotracheal tube. We have a very experienced management team. Our co-founder, again, Dr. Richard Lazzaro and Rob Israel, are both leading medical and entrepreneurial experts. Other members of our team round out greater than 100 years of experience in the medical device, as well as defense industry. And we're actually in process of working through our seed capital raise. We've got an estimated $6.3 million raise that we're seeking, and yet we've actually soft circled and closed greater than 60% of that raise. So we're looking to round out and finalize that. At Lazzaro Medical, again, we're creating a solution for the most common disease that hopefully very soon you will have heard of, called tracheobronchomalacia. And every common surgical procedure has had a beginning, and this is the beginning of giving people their ability to breathe back.
Awesome. Thank you, Dawn. Love the video of the lady really living it up. So talk to us about the timing and the pathway to FDA clearance, because obviously that's going to be really critical for you all.
Sure, and that's a great question. So again, our pathway to the FDA is a 510(k) pathway. So we're actually in process right now of putting together all of our data and compiling all of our verification and validation testing. That submission is going in targeted in April of 2023, with then an FDA clearance targeted for the end of 2023 and a commercialization in early 2024. So again, in the device industry, a fairly abbreviated time to get through the FDA and to be able to get into commercialization.
That's great. And how are you planning to really proliferate into the market and gain some market adoption? Tell us about that plan.
Another great question. So again, we've got a couple of aces in our hole in the fact that we've got the thought leaders and really the pioneers of this surgical procedure really affiliated with the organization or very much with a vested interest in getting this disease out and open. So Dr. Lazzaro, as well as some other physicians within that circle, have been trained on the procedure. They are doing the procedure, and they're excited for our scaffold system to come into the fold to be able to make the procedure more democratizable to their peers and to their patients.
And speaking of training, what is the plan for training physicians and how do you scale that?
Yeah, that's a great question. So we're very, very fortunate to have a collaboration actually with a very strategic partner, and that strategic partner is one of the leading robotic companies in the space. So one of the aspects is partnering actually with them to conduct the training on the scaffold system. But the best news is that the actual procedure that Dr. Lazzaro has pioneered is a procedure that the physicians actually, for the most part, do on a day-to-day basis. It's got similar components to the procedure as lung cancer. So it's a very familiar procedure for them. And really, for us, it's just training them on how to suture and actually affix our scaffold system in that specific procedure.
And last question, given this is really a new market, and you mentioned the competitive landscape as you don't have any competitors. Are there other technologies that have done something similar that are analogous to what you all are doing?
Yeah, that's a great question. So as I had shared at the end, every surgical procedure has a beginning. And there are many examples of hernial procedures. So that used to be a very kind of uncommon procedure. And now it's a mainstay in surgical practice today. Cataract surgery in the 50s. Now, again, something that people get surgical intervention for on a very common basis. And even most recently, TAVR, which is the aortic kind of catheter treatment of aortic disorders. Oftentimes in the medical device space, There are diseases out there, and once we find a treatment that people can actually, use and be treated for, the market opens up, and we're on the cusp of that. We're very excited about it.